Hi, this is Thomas Spencer with my presentation on post-traumatic stress disorder. Post-traumatic stress disorder is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, series of events, or a set of circumstances. An individual may experience this as an emotionally or physically harmful or life-threatening and may affect mental, physical, social, and/or spiritual well-being. Some symptoms of the simple and complex. The simple is just going to be re-experience, avoidance, and sense of threat. In the complex PTSD, you're going to have re-experience, avoidance, and sense of threat, but you're also going to have affective dysregulation, negative self-perception, interpersonal issues. Again, the definition, which we already talked about, but goes in more detail, develops in individuals who have experienced a traumatic or shocking event. Doesn't have to be dangerous, but could be sudden or unexpected. Some long-term effects: the individual experience symptoms within 3 months of the event, but these symptoms can also occur later. I also took a quick quote that I thought hit home with me with having PTSD myself. The reason for me picking PTSD is if you imagine burnt pork in plastic, I still taste it, says Chris Duggan on his experience as a soldier in the Falklands War in 1982. The helicopters were coming in and we were asked to help get the boys off. When they opened the door, the stench was horrendous. When he left the Army in 86, he suffered from PTSD. I was a bit psycho, he says. I was verbally aggressive, very uncooperative. I was arguing with my wife, and eventually we divorced. I decided to change the kitchen around one day, get all new stuff, so I threw everything out of the window. I was 10 stories up in a flat. I poured brandy all over the video, and it melted. I flooded the bathroom. It's just, I think that hit home with me because the biggest things that set me off still to this day, and I've been retired for 10 years, is smells and tastes. If I just smell anything that can set me off, and it puts me back into the streets of Baghdad or the mountains of Afghanistan. So it just hit home, so I wanted to share that. Post-traumatic stress disorder, there's 5 stages of PTSD. The first is impact or emergency stage, denial and numbing stage, and then the rescue stage, including intrusive or repetitive stage, short-term recovery or intermediate stage, and then long-term reconstruction or recovery stage. Some causes, like myself: military combat, sexual or physical assault, abuse or neglect, natural disasters, and auto accidents. Some symptoms: intrusive memories, avoidance, adverse changes in thinking and mood, and changes in physical and emotional reactions. The abstract I chose, the first abstract being combat exposure, post-traumatic stress systems, and health-related behaviors, the role of sleep, continuity, and duration. Goal of the study was, does sleep quality and quantity in combat can it predict post-traumatic stress symptoms? The methods used were completed surveys from 2,420 soldiers assessing combat, psychological, and behavioral health factors 3 months after their deployment. Purpose, desired outcome: to find any association between a soldier's sleep quality and quantity and PTSD. The limitations, some limitations include not all 2,420 witnesses had the same trauma during deployment. You're not going to see the same, being overseas, you're not going to see the same. I know they took from a combat brigade, but you have medics, you have all different types of walks in life. You even have every different type of medics. They're not going to see the same thing as your infantry, I guess is my point on that. The interplay between post-traumatic stress disorder and dementia, a systematic review. Does PTSD increase the risk for dementia in veterans and civilians? The method used was a systematic review of Web of Science core databases pertaining to both PTSD and dementia of individuals up to November 2018. Purpose, desired outcome, to find any association between people with known PTSD and developing early dementia. Some limitations include, of the 25 articles of people generated from the database, they are not separated by simple and complex PTSD, because this could skew the results either way. Abstract 3. Acupuncture for combat post-traumatic stress disorder. Trial development and methodological approach for a randomized controlled clinical trial. Goal of the study, determine both clinical and biological effects of Verum acupuncture for combat-related PTSD and treatment for U.S. veterans. Methods used, a 2-arm parallel group prospective randomized placebo-controlled clinical trial. Purpose or desired outcome. Desired or primary outcome is change in PTSD symptoms severity from pre to post-treatment. Limitations, not enough funding and volunteers to complete their study. The metabolomic analysis of male combat veterans with post-traumatic stress disorder. This goal was to determine if male combat veterans with PTSD have an increased risk of developing several serious medical conditions, including autoimmune disease, cardiovascular disease, and diabetes. The method used was a case control study comparing metabolomic profiles from 52 aged males, combat trauma exposed veterans from Iraq and Afghanistan with 52 with PTSD to 52 without PTSD. Purpose, desired outcome, taking just blood samples of 104 soldiers, finding any correlation between PTSD and increased risk of diabetes, etc. Include autoimmune and cardiovascular. Limitations, no information on smoking habits, drugs, and alcohol abuse in any of the 104 participants, because this can also weigh in or skewer the results. The hyperlink. Before I do the hyperlink, I provided, so this shows the brain on trauma. There's the everyday brain, if you compare it like to an engine, it's running on green. So the amygdala is doing very well. It's in the green. In the hippocampus, memories are being processed in the brain and stored in the normal way through the hippocampus. When you have trauma, anything that could be related to a factor cause PTSD, the amygdala, the threat level is so high that the amygdala is fully activated and overwhelms the brain, which shuts off the hippocampus and cannot store memories in the normal way. Now moving to our hyperlink, PTSD treatment for veterans, what's working, what's new, and what's next. Goal of the study is the best treatment for veterans with PTSD. Methods used, research study on significant risk factors for combat-related PTSD in military personnel and veterans. Purpose, desired outcome, in providing further opportunities for the VA and other healthcare systems to develop new and innovative ways to overcome barriers to train veterans with PTSD, including veterans and their families increasingly seeking care outside of the VA system. Some limitations included education, training, and tools to improve every soldier's understanding of the PTSD and their options for treatment now and in the future. That is the end of my PowerPoint, but I have a quick, some related topics that I would be interested in exploring further in my course project would be the correlation between PTSD symptoms and tinnitus severity on military veterans, or if there are any effects that nicotine have on PTS levels. there's 5 different levels of PTSD. There's a severe, and I would just try to explore to see if nicotine has any effect on worsening the cases of PTSD. Thank you, and have a great day.